Hello class. I chose to do my project on COVID-19 pandemic. My name is Jessica Holland. I've been a registered nurse for 12 years in the ICU, and I chose my article topic about 2 months ago, knowing that this would not only be taxing on the healthcare system, but also on our economy globally. Pandemic history. As you can see here, we have had multiple pandemics throughout history. I would like to point out the multiple times the bubonic plague strikes throughout our history, as well as smallpox and derivatives of the coronavirus that originated back as early as 2012 in the MARS, Mid-East Respiratory Syndrome, and the SARS, the Severe Acute Respiratory Syndrome, and now we see the coronavirus again in COVID-19. So COVID-19, what is it? Well, it does mean novel coronavirus disease of 2019. It is a new virus with its very own characteristics. It's highly transmissible and substantially fatal when in contact with humans. So what does novel mean? Well, due to its agility to adapt, that's why we defined it as novel. So this was actually reported to the World Health Organization by China on January 10th of 2020 and has been named this COVID-19 as a genome sequence and identified as a zoonotic source of infection from bats. Transmission. So the CDC reports COVID-19 is transmitted through droplet during close, unprotected contact between an infected person and an uninfected person. So it is considered droplet, but airborne precautions has not been reported for this virus. It can be spread during certain aerosol-generated procedures in healthcare facilities, making this virus then airborne. An example of this would be during a nebulizer treatment. This virus could potentially become airborne. So isolation and extreme social distancing have been implemented to interrupt this chain of transmission nationwide. The virus is thought to be spread through droplet with close contact to one another. Close contact, they're saying, is about 6 foot and contagious before the symptoms even start. It can also be spread by touching a surface that has COVID-19 on it and then touching your mouth, nose, or eyes. So who's at high risk? Mainly our vulnerable populations. And those include people 60 years or older, mainly in the long-term living facilities or nursing homes, or people with chronic medical conditions like heart disease, lung disease, diabetes, or have a weakened immune system. We must also take into consideration people who have end-stage liver and kidney disease to the point where with kidney disease they're requiring dialysis. What are the symptoms of this virus? So the virus may present with an asymptomatic carrier. Asymptomatic simply meaning no symptoms. Or you could have symptoms, as the CDC says, of a high fever, which is a temperature greater than 99 degrees Fahrenheit, a dry, irritant, and constant cough without producing mucus, some shortness of breath, and a most recent symptom added by the CDC is diarrhea. Now, people with COVID-19 generally develop signs and symptoms around day 5 or 6 after they were infected. So this means the incubation period can be anywhere from 1 to 14 days. So that's why you could be contagious before your symptoms even start. Next we have here, how can we protect ourselves and prevent the spread of this virus? So, as the CDC recommends, we want to wash our hands with an alcohol-based sanitizer or soap and water. Also, cover your mouth and your nose with your elbow or a tissue and throw the tissue away when you're done. You want to keep at least 6 foot between you and somebody else who may have a cough or sneeze. And if you develop any of those symptoms we went over in the earlier slide, you want to contact your medical doctor before you go to a hospital. So you want to try your best not to touch your eyes and nose and mouth like we went over earlier. How do we diagnose COVID-19? So the FDA finally approved this nasal pharyngeal swab that is a PCR or polymerase chain reaction. Right now, it comes back in 24 hours, the results. We are awaiting the rapid test, which will take about 15 minutes. And I want to say this is why we're seeing such a huge increase in the amount of positive cases in our area because of the amount of time it takes for these tests to come through. So when the rapid finally is dispersed to all the hospitals and allowed to test with it, I do believe we will see a huge incline because we're able to test more people in a 24-hour period. So treatment for this virus include Plaquenil, which we've used for malaria, and remdesivir that we've used for Ebola. Next, let's look at the death rate globally. And Italy is the highest, being at 49.3 millions. Then Iran at 13.9, Spain at 13.7, the Netherlands at 3.9, France at 3.6, China at 2.3, South Korea 1.8, United Kingdom at 1.6, the United States at 0.5, and Germany at 0.3. Now, this data is up to date as of March 19th, 2020. Next is the mortality rate by age. And this is important because this virus is affecting even the younger population or, say, middle-aged. Of course, we have the high-risk group, which has the highest mortality, mainly in Italy. But I am looking at a median age here, it looks like affecting anywhere from 40s to 60s. This slide here shows the business cycle framework and as a result of the coronavirus, and it actually shows the recovery, expansion, and contraction of economic growth, as well as the cycle phase of early, mid, and late recession. In Spain, Brazil, Australia, Canada, France, US, Japan, South Korea, United Kingdom, Mexico, and India, as well as China. This slide here shows our financial impact with travel across the countries, the highest being $49.7 billion, mainly in the Australia, China, Japan area. I just want to point out here that Canada and US are $21.1 billion. With the coronavirus, about 80% of people recover from this virus without needing any special treatment. Now, we do discharge patients after they've recovered. We make sure that they've had 2 negative swabs of the nose 24 hours apart, and we do ask them to wear a mask and return for follow-up care. Disease and globalization. International sanitation conferences are held in an effort to prevent the spread of infectious diseases throughout the world. The Center for Disease Control, CDC, and the World Health Organization, WHO, emphasize the importance and do research for the development of medicines to prevent the emergence and spread of infectious disease throughout the world. Some factors that affect disease and globalization are, as we mentioned earlier, trade. Trade has been a major facilitator in globalization and spread of the infectious disease. Think about the bubonic plague. It was transmitted throughout Europe and through trade with Asia. Some other factors would be war and conflicts. They have contributed to the outbreak and spread of disease. Our soldiers in the American Civil War were more likely to die from infectious disease than they were from fighting in the war. Also, poverty. The poorest countries are usually part of contracting the infectious disease, and that's mainly due to the way they live, the overcrowding, malnutrition, inadequate medical care, and unsanitary conditions that mainly promote the growth and transmission of infectious disease, as well as pathogen natural selection. Now, this is important because of the antibiotics that are placed in our agricultural products, such as some of the meats that we eat, and our overuse of antibiotics in the medical facilities. And this really does make the disease strains more powerful and causes resistance to a lot of the medication and antibiotics that we're using now. So in conclusion, COVID-19 has now spread to over 150 countries and has been identified in all states in the United States. It has had a noticeable impact on global economic growth. Here I'd like to comment on the supply and demand effect, mainly with us not being able to get all of our PPE and all the Apple lovers not being able to get their Apple products from China. It's estimated that the virus could trim global economic growth by at least 0.5 to 1.5%. The government across the countries are working internationally to address the effects of this virus. They're all working together to try to come up with vaccines and medication to treat. The development of a safe and effective vaccine for this highly communicable respiratory virus is important to epidemic and pandemic control, and hopefully it will be discovered soon. I wanted to show my list of references here. I referenced each slide throughout, so feel free to look up some of these articles. They were a great resource to read. I wanted to thank everybody for taking the time to listen to this, and if you would happen to have any questions, my email is also listed. Thank you, and have a nice day.